Friends, today we are going to discuss about some important questions from scapular region for your Viva and semester examination. And if you have not subscribed my channel yet, please subscribe my channel and support us. So starting the scapular region, the first important topic in scapular region is deltoid muscle. The first important point about deltoid muscle is that it is an example of multi-pinnate muscle. This is the most important question in Viva, multi-pinnate muscle. Now coming to the origin of the deltoid, so it is taking origin from three regions. The first one is from lateral 1/3 of the clavicle. The second one is from your lateral border of acromion process of scapula, and the third one is the lower lip of the crest of the spine of scapula. So these are the origin of the deltoid muscle. Now coming to the insertion of the deltoid muscle. So the deltoid muscle is inserted at deltoid tuberosity, which is present at humerus bone. Okay, deltoid tuberosity. Now coming to the nerve supply of the deltoid muscle. So deltoid muscle is supplied by axillary nerve, okay, which has root value C5 C6. So these are all things about deltoid muscle. Okay, now coming to the other muscles of the scapular region. In this, the first muscle is your supraspinatus. The second one is your infraspinatus. The third one is your teres minor. The fourth one is your teres major, and the fifth is your subscapularis. These are the muscles which are related to the scapula. Now I am drawing a very rough diagram for the scapula. Okay, and we will see the origin and insertion of the muscle. So this is your acromion process. This is the spine of scapula. Okay, and this is here is your, suppose this is your humerus bone. Okay, very rough diagram. Now from this part, from the medial tooth of the supraspinous fossa, this is your supraspinous fossa. Okay, so from supraspinous fossa, the muscle taking origin is your supraspinatus, and this is your infraspinous fossa, and from here the muscle taking origin is your infraspinatus. Clear? Now from the upper 2/3 of the dorsal surface of the lateral border, okay, this is your lateral border. From here the muscle which is taking origin is your teres minor, and from the medial tooth of the subscapularis fossa, which is present at the medial 2/3 of the subscapularis fossa. In subscapular fossa, the muscle taking origin is your subscapularis. Okay, and from lower 1/3 of the dorsal surface of the lateral border and inferior angle of the scapula, the muscle taking origin is your teres major. This is dorsal surface, and on ventral surface subscapularis muscle is present. Okay, I am showing a diagram of the dorsal surface. So here teres major is taking origin. Now coming to the insertion of this. Okay, so before going to discuss insertion of the muscle, first you know that humerus has greater tubercle. Greater tubercle is present on humerus, and on this greater tubercle of humerus there are three impressions. Okay, the first impression is upper impression, the second one is known as middle impression, and the third one is known as lowest impression. Okay, and on the upper impression, supraspinatus muscle get inserted. At the middle impression, infraspinatus muscle get inserted, and at the lowest impression, your teres minor muscle is inserted. Okay, so this is the most important point of the scapular region for Viva. Okay, detailed insertion of the muscle which is present on the greater tubercle of humerus. So upper, middle, and lowest. Upper for supraspinatus, middle for infraspinatus, and lowest for teres minor. Getting? Okay. Now, and remaining, that is your one is teres major. It is on the medial lip of the bicipital group. This is also most important, medial lip of bicipital group. Okay, so the insertion of these muscles are very important. Okay, whether insertion, I am again saying insertion of the muscle is very important from your Viva point of view. Viva. Okay, short notes and long notes rarely come on this topic, but Viva questions are very important. Clear? Now we are moving for next part of discussion, that is your so rotator cuff. Okay, this is the most important portion, very very important. Okay, I am getting 3 star. That is your rotator cuff muscle. It includes sits, SITS. Okay, S for subscapularis. This is for subscapularis. This for infraspinatus. Okay, and this is for teres minor, and this is for supraspinatus, or you can use this for supraspinatus, then this is subscapularis. So these 4 muscles make rotator cuff. Okay, this is the most important question, also comes in short notes. So you have to describe first that rotator cuff consists of 4 muscle, and then you have to go for the description of this 4 muscle with diagrams. Okay, now moving to the next part, that is the intermuscular spaces. Which is intermuscular spaces. Again, very important topic, very very important topic. Okay, from the scapular region, very very important. That is the intermuscular spaces. So first, looking for a simple diagram. So suppose this is your scapula. Okay, and this was your, suppose this is your humerus. I am taking a rough diagram. This is your humerus. So, very 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 bad diagram. This is your, suppose this is your humerus. Clear? Okay, now from here I have told the muscle is your teres major muscle. This is your teres major muscle. Clear? And changing column, and this is, here it is your, this is your teres minor muscle. Okay, and emerging there, this is the teres minor muscle. And from here this muscle which is going like this. Okay, very top diagram I am drawing. This is your long head of biceps brachii. This is long head of biceps brachii. Clear? Now see, here I am taking another. So see here this is a triangular area, this is a rectangular area created, quadrangular area also, quadrangular area, this is triangular area, this is again a triangular area. So 2 triangular area is present here and 1 quadrangular area is present in this here. Okay, now coming for the discussion of these areas. So first coming to discussion of the boundary, you can easily appreciate the boundary. Okay, so first coming to the discussion of quadrangular spaces boundary. So quadrangular space, this space. Okay, this space is known as quadrangular space. So inferiorly it is bounded by the superior border of teres major. This muscle is teres major muscle. So superior border of teres major. Medially it is bounded by lateral border of long head of triceps brachii, because this is the triceps brachii muscle. So this is the lateral border of triceps brachii, and medially it is laterally it is bounded by surgical neck of the humerus. Okay, these are the boundary of quadrangular space. Now coming to the upper triangular space. This is the upper triangular space, and this is your lower triangular space. So upper triangular space. So inferiorly it is bounded by superior border of teres major. Clear? Laterally it is bounded by medial border of long head of biceps brachii, and your superiorly it is bounded by, okay, and inferiorly it is bounded by, see, teres major superior border. Laterally it is bounded by medial border of long head of triceps brachii, and superiorly it is bounded by this muscle. This is your teres minor muscle. Okay, so this is the boundary of this. Coming to the boundary of inferior lower triangular space. This is the lower triangular space, its boundary. So medially it is bounded by lateral border of long head of triceps brachii. This laterally it is bounded by humerus, and superiorly it is bounded by teres major. Clear? Now coming to the contents of this spaces, very important. So first coming to the content of quadrangular space. Okay, quadrangular space. So the content of quadrangular space is axillary nerve, because axillary nerve has to supply deltoid muscle, and deltoid muscle insertion is at humerus. So, and the space which is most closest to deltoid towards it is upper quadrangular space. So axillary nerve passes through that, and along with axillary nerve one vessel, that is PCHA, posterior circumflex humeral artery, that is a branch of axillary artery. Clear? And the second space is your upper triangular space. From upper triangular space one artery is passing through, that is circumflex scapular artery, that is circumflex scapular artery. And from the lower triangular space, the most important is your radial nerve, because it is going to radial groove, and lower triangular space is most nearest to radial groove. And along with is profunda brachii vessels. Okay, profunda brachii vessels. So these are the contents of the quadrangular spaces, and upper triangular spaces and lower triangular spaces. So please go through these spaces. These are the very important intermuscular spaces and frequently asked in your examination. And the last important portion about scapula is anastomosis of scapula. Okay, anastomosis around scapula. In this, the first is one anastomosis around body of scapula. Okay, and the anastomosis around body of scapula is done by three artery. The first one is your suprascapular artery. Clear? Suprascapular artery, which is a branch of thyrocervical trunk. It is a branch of thyrocervical trunk. The second one is your deep branch of transverse cervical artery. Okay, deep branch of transverse cervical artery, which is another branch of thyrocervical trunk. From thyrocervical trunk, two branch which is taking from thyrocervical trunk is participating in anastomosis around body of scapula. The first one is your suprascapular artery, and the second one is your transverse cervical artery. And the third artery is your circumflex scapular artery. Circumflex scapular artery, which is a branch of subscapular artery, Okay, circumflex scapular artery. So these are the vessels which are participating in the anastomosis around body of scapula. The second anastomosis is around acromion process. So when you will get a question on writing that write the anastomosis around scapula, you have to write both anastomosis around body of scapula and anastomosis around acromion process of scapula. And now coming to the blood vessels which is participating in anastomosis around acromion process. The first one is acromial branch of thoracoacromial artery, which is a branch of second part of axillary artery. Acromial branch of suprascapular artery. Okay, suprascapular artery. It is again part of subclavian artery, first part of subclavian artery, sorry. And the third one is acromial branch of the posterior circumflex humeral artery. That is the branch of axillary artery, third part of axillary artery. So these are the important questions for your examination in scapular region. So if you have liked the video, please subscribe our channel and share with your friends. Thanks for watching.